Hey, welcome back to the fourth and final module on how to support your client through an induction. In this last one, we're going to talk about Pitocin and like the risks and benefits of Pitocin, and then we're also going to talk about like maybe when is a good time to join your client, and also go through some like last minute tips and suggestions. Okay, so Pitocin. What is Pitocin? Pitocin is the synthetic form of the hormone oxytocin. Pitocin causes the uterus to contract, which can help induce labor or augment labor or help control bleeding, etc. So, Pitocin is causing your uterus to contract, causing contractions. Okay. When your client finds out that she needs to be induced, she's probably at least thinking that Pitocin might be on the table. And she's probably heard some scary things about Pitocin. There's a lot of stories and information, and whether it be true or not true, there's a lot of media attention around Pitocin. And so I would kind of gauge your client on, like, gauge how she's feeling about Pitocin, what has she heard about it, and maybe we can dispel some myths or help her maybe feel a little bit better about it, because really Pitocin, it is not the devil like some people or agencies might portray it to be. It is a tool that we can use, and when we're trying to put somebody into labor, it is a really effective tool to help us do that. Now, when someone goes in for an induction, they are going to have an IV started. That doesn't need to be hooked up to anything right away. Usually they'll start it like when someone's admitted, but they don't need to be hooked up to IV fluids or anything like that. It just kind of will hang out on their arm and be like capped off until it's needed. And then Pitocin is delivered through an IV. So when it's time to start Pitocin, they are going to run Pitocin with IV fluids at the same time. And it's started very slowly at a really low dose. They do not dose Pitocin now the way that they used to in the 80s or 90s. So they were much more like, let's crank this up back then, and now they go very slow. It's very titrated. It's very like carefully administered. So usually about 1 to 2 milliliters an hour is like the lowest dose is a 1. And that's usually what they start with, is a 1 or 2. And then the nurse is going to gradually, slowly raise that level of Pitocin. Usually she'll increase it by 1 or 2 milliunits every 30 to 60 minutes. Until the goal is that we're going to keep increasing it every 30 to 60 minutes until that mom is in a regular contraction pattern and is having contractions about every 2 to 3 minutes. So once you get into that pattern, we're going to stop increasing the Pitocin and just leave it where it's at. Okay. And remember, from what we talked about previously, we don't know that those contractions are necessarily adequate, but they look good on paper. And so we kind of start there and see how that works. And then if that's not working and we need more information, that's when things like the IUPC is going to come into the picture. Okay. Now, Pitocin is going to be left on usually until you deliver. It's able to be turned up, turned down, turned off, and it works pretty fast. Usually it's, I want to say maybe like, I don't know what the half-life is. Half-life is off the top of my head. I should know that. But I want to say it's like maybe around 15 minutes. So when you first start Pitocin, most people don't notice a big difference or really feel anything for about an hour. You might notice some contractions within about an hour. And then sometimes people will take 3, 4, 5, 6 hours before they even notice anything. So everyone is really different on like the amount of Pitocin that their body needs to start having strong contractions. If for some reason baby isn't tolerating the Pitocin contractions, and maybe their heart rate is dropping with every contraction, or is looking concerning, then they're just going to stop the Pitocin, and then we'll kind of like reevaluate and come up with a different plan. Okay. Now, what I recommend as a doula is that my clients ignore and nap as long as possible. Does this sound familiar? So ignore the contractions as long as you can. The client might feel them within 30 to 60 minutes, or maybe not for hours. So this is kind of their last chance. Get that one last nap before you can't nap for maybe years. Who knows? You tell me how easy it is to nap with a newborn. Not super easy, but you get my point. Okay. Also, distract yourself. So if you always, in my book, sleep is number one, always. If you can sleep, do it. When you can't sleep, then distract yourself so that you're not like focusing on these early contractions. So start like a movie, or play a game, or listen to music, read a book, something like that. Eat normal meals, kind of as long as you can, and whatever sounds good to you. Hydrate, adding in those electrolytes. Make sure that you keep peeing frequently, because keeping your bladder empty is going to help baby be able to descend into the pelvis. So making sure that you're peeing when you need to. And then when things are kind of getting like, well, yeah, that I'm really feeling this now, and you can't sleep, and you can't ignore, and you maybe can't distract yourself, then I would start utilizing labor positions. So a ball, maybe a walk, some stretches, some lunges, some circuits, things like that, and kind of think about changing your position every 30 to 45 minutes is a good idea. Okay, how Pitocin is administered. I already mentioned that, but it's via IV, and the nurse will increase the dosage a little bit every 30 to 60 minutes. She's going to go up by like 1 or 2 milliunits an hour. As you can see in that picture, that Pitocin is at 20, which is kind of like the max before they really want to like, let's get a good picture of what's going on here before they might go higher than that. And then when you're on Pitocin, you will need to have continuous monitoring, because this is causing contractions. Babies can react to contractions, and so we want to know how baby is tolerating these Pitocin contractions. You're also going to have a little bit more restricted movement, and that's just because you have an IV and it's hooked up to meds. You're also, being monitored continuously. So you're going to have either, wires connected to your belly, or they do often have like telemetry units. Those could still be like the belly band ones, but they might have like a wireless monitor so that you can still get up and walk around. Usually those can still go into the bathtub or the shower, which can be really handy. And then there's also ones that are like stickers, which are also wireless. So ask about those as options so that you're not like stuck in the bed, having to be close to the monitors. But yeah, it kind of feels like there's some wires and attachments to the body, which isn't super fun. The risks, we'll talk through the risks and the benefits of Pitocin. So the risks can be that it can cause your uterus to become overstimulated and maybe contract too strongly or too frequently or too often. And that could result in placental abruption or a uterine rupture. Those are both very rare and more likely to happen if you've had a previous C-section or like a scar on your uterus. Chances still are very low. If your uterus is contracting too strongly or too often, your baby might not tolerate that and could respond to this by a change in heart rate, which could be concerning. So to remedy that situation, they're going to turn the Pitocin either down or off altogether and kind of let baby recover. And if the baby recovers nicely, they'll kind of like let that baby look great for 30 to 60 minutes, and then they might restart the Pitocin at a lower dose and kind of go from there. If the baby does not recover quickly, then a cesarean would likely be the next step. Sometimes people have said that Pitocin makes contractions more painful. I personally think that there's a lot of factors involved. So inductions are not the same as your own body going into labor on its own with its own naturally occurring physiological labor hormones, and now we're kind of forcing this to happen with synthetic meds, and we're causing your body to do something that it wasn't quite ready yet to do. So although it might not hurt more, your body and your mind aren't in the same place as if this was occurring naturally, and I think that matters personally. So I would describe Pitocin contractions to be a bit sharper and maybe have like a little bit less of a gradual peak to the contraction. So if a normal contraction's like this nice little mountain roll, I feel like Pitocin contraction is more like woo, way like a more sharp, steep incline. Then it's not as gradual as like your body would normally maybe do. So plus you're not having that like natural hormone cocktail that does help you kind of cope with pain. So I just think it's kind of like you're just thrown into it a little bit harsher and a little bit sooner with less of a gradual buildup. That's just my personal opinion. But, also you do need to have really strong, usually pretty painful contractions to have a baby. And so I don't necessarily think it hurts way worse. I think for some people it can, but not for everyone. It is harder to have an unmedicated birth with an induction or with Pitocin. It's not impossible. I have seen it done. I personally have had an induction birth with Pitocin and didn't get an epidural, but I wouldn't say that is the norm, especially for a first baby. If it's not your first baby, I think the chances of going unmedicated are much higher, because usually your body has done this before and it just responds so much better and quicker and easier. But for a first baby, it's hard to be induced and go unmedicated. That is just my personal opinion as a doula. Doesn't mean you can't. It's just it's a bit more difficult. Okay. Risks of Pitocin continued. Some studies have suggested that there's a higher instance of postpartum depression and anxiety with Pitocin use, and possibly less success in breastfeeding. There's still a lot more to research in regards to those findings, and something I usually kind of say to that, I didn't want to just dismiss it and not mention it in this talk, but I also think that is, it's a hard thing to gauge, because are people having more postpartum depression and anxiety because they were induced or because maybe they didn't get the unmedicated birth that they wanted? Like, is that what's are those feelings contributing to that? Or is it from the Pitocin? We don't know. And that's like going to be really hard to separate and study. So I think that's out there, but I think it's not, like, what am I trying to say? I don't think it's, super strongly researched yet. Okay. I think you get what I'm saying. The longer that you're on Pitocin, the greater chance you have of having increased bleeding or postpartum hemorrhage. So a recent study showed that women who were exposed to Pitocin for 12 or more hours were 52% more likely to experience a hemorrhage after delivering their baby. That is sometimes why providers want to, like, let's keep going up like a little hard on Pitocin rather than a little bit more gradual increase, because they're like, if they're on Pitocin for a lesser amount of time, that is going to decrease their chance of hemorrhage. That is true. However, this also could increase your risk of having a C-section. And when you have a C-section, you're also at a more increased risk for hemorrhaging. So, you know, there's pros and cons to all the things. I say slow and steady is still a good idea. Pitocin has a bad rap in many social media circles, but is a really good tool when it's needed, and it's often very successful in helping women to achieve a vaginal birth. So don't write it off altogether. Okay, I will give you a couple tips on like when to join your client for an induction. I definitely encourage you to talk to them prior, either like a FaceTime or an in-person or over the phone or something, to just like connect with them, see how they're feeling, answer their questions, and remind them of like the slow and steady and like what you should pack and how we're mentally going to cope through this kind of waiting game time. So that is always helpful to kind of like remind them of their expectations. If you use a TENS unit or you have extra, I think it's a great idea to let them borrow that and show them how to use it, because that can sometimes be really helpful when they might be feeling uncomfortable from a balloon or uncomfortable from a cervical ripening med, but they're not really in early labor yet. I would kind of handhold them via text and phone support through these initial stages of an induction. I always tell people, like, I want to know everything. I want to know when you get there. I want to know all your cervical exams and like what the plan is. And I'm here for questions, and let's chat about all the things. And I am very much like there in it with them, but just mentally. And then I tell my clients that I will join them when they are needing in-person support, either physically or emotionally. I remind them that I treat inductions like normal spontaneous labor. So I'm going to join them when they need me, which usually is in the middle to end of early labor or kind of the start of active labor. Often for an induction, they might ask for you a little bit earlier than someone who went into labor on their own. And that's just because things are hard and they feel like they've been there doing this for a long time. And that's okay. So I already mentioned this, but I want to know all the things, all the exams. I sometimes will ask to see like their contraction pattern, offer guidance and positions and all of that kind of stuff. I'm always available for a phone call if an intervention is suggested and they're maybe not sure what to do. They want to talk to their doula. They can always tell their provider or the nurse that they want a few moments to think about it, to discuss it, talk to their doula, etc. If the plan is to break water, especially if they're already on Pitocin, that is usually a good time for me to head to them. Because sometimes things can escalate quickly. Either progress is being made fast, or the labor will intensify like quite a bit when that happens. And I want to be there for that so that I can support them through when things start getting a little bit more intense. And then I would share this with my clients. So those were kind of tips for you as a doula. These are tips that I would give my client to remind them we want to ignore everything as long as possible. Slow and steady wins the race. Ignore it, eat, sleep, hydrate, repeat. Distract yourself when you can't sleep anymore. And then when you can't sleep anymore, then you can start to like be active and do positions and bring out like coping tools and things. Bring comforts from home, like your own pillow, a blanket, your own clothes, your own, things that you think you might like. And then do not be afraid to use sleeping medications or aids if you need them. That is absolutely beneficial for you and okay to do. Okay, with all of that, I am wrapping this induction talk up. If you want more content like this, you will love my Elite Doula community. I have created a membership of like-minded doulas who want to expand their knowledge in all birth topics, learning how to best support your clients, build and sustain a thriving birth business, and become experts in the field of birth. So, what does this look like? My Elite Doula community is a membership. So you're going to get a monthly mastermind topic just like this one. So every month we're going to like deep dive into a different topic, and it could be this is kind of like a continuing ed topic about inductions. We might dive deeper into things like gestational diabetes or high blood pressure or cesareans, and we'll kind of like get into some stuff that you maybe aren't taught in your doula training, but you're definitely going to encounter it as a doula, and you want to know the things, and you want to feel like you know what you're talking about and that you've learned how to handle this. So we'll have a lot of things like that. And then we're also going to have a lot of business stuff. So we'll talk through contracts and backup doulas and how many clients you should take and what you should pack in your doula bag, and how to master doing a client interview, and just all kinds of things like that. So we'll have a monthly topic, and then you're going to have access to me for questions and guidance and support. We're going to have a private community, every doula who's in the membership, so that we can all support each other. You can make friends, you can find backups, you can really kind of find your birth business bestie in there. And we're going to have weekly calls for accountability and encouragement, and kind of what are you working on now and how can we help you? So that's gonna come with accountability and resources, and it's gonna be amazing, and I'm really excited about it. So like I said in the very beginning, I've been a doula for 16 years and have been to about 900 births. So I have seen literally all the things. I do not think that there's anything I haven't seen yet. Very few things that I haven't seen. So I am ready to pass my knowledge, my expertise on to you guys, and kind of help create really good, passionate, knowledgeable, excellent doulas. So let me help you. I would love to do it. And let me know if you have any questions, or if you want to share an induction story, or you have any suggestions for me, or questions on anything that I've talked about already. And with that, I am done, and you have got this, and you're going to be a great doula. So, goodbye and thank you for coming.